Good evening, everybody. This is DMA's FMGE hacks, and today we are going to talk about the radiology. So, speaking about the radiology, we are having the very high yield area is your thorax and the chest radiography, followed by like a general principles, and then followed by imaging techniques. So here we divide the radiology into three sections. Here we divide the radiology into three sections. One is your basics of radiology, imaging in orthopedic disorder, and the imaging in musculoskeletal disorders in children. Imaging in musculoskeletal disorders in children. So are the three areas we're gonna see here. So speaking about the basics of radiology, people. Speaking about the basics of radiology, we need to know about all the X-ray instruments, all the imaging instruments we are having. For example, like the tools we use to take the images, like X-ray, CT scan, MRI, and ultrasound, and their mechanism, how they are working, what sort of organs can be visualized using these tools. You have to remember each and everything, which one is more preferred for bone disorders, which one is more preferred for soft tissue disorders, and all. You have to remember this is a basic radiological imaging techniques. While here you may see the radiological anatomy. Speaking about the radiological anatomy, interpretation of radiological images of your bones, joints, and spine are pretty important. And then radiological sign, the common radiological signs are pretty important. For example, like a named fractures, named signs, and named views, all of them are considered to be the high yield area. You should not miss it. So this covers the basics of radiology, people. So speaking about the next area, which is imaging in orthopedic disorders. So images in the orthopedics holds the highest value here, because like most of the questions from the orthopedics can be integrated with the radiology. So they may give you the x-ray of some image or some fracture, and they may ask you what sort of fracture it is, or they may ask you like what type of fracture it is, or they may ask you like what is the name of this fracture and all. For example, like they give you a dinner fork deformity and they will ask you what fracture is associated with the dinner fork deformity. You should always know that it's a Colles fracture. So in those kind of orthopedic fractures will be asked. For example, like what are the images they may ask you in the orthopedic disorder? One could be a fracture, where you see the radiological imaging of different types of fracture, including the simple fracture, compound fracture, and the comminuted fractures. They simply give you the x-ray of the image, and they may ask you what type of fracture it is. It is simple fracture or compound fracture or comminuted fracture. Then you have to identify which fracture it is. That covers you a very important areas or aspects here. And then you have a joint diseases, where you see the radiological imaging of your osteoarthritis, rheumatoid arthritis, gout, and ankylosing spondylitis. All those things are pretty important here. For example, they may give you the bamboo spine, and they may ask you like what is the diagnosis. What the diagnosis? It should be ankylosing spondylosis, which is associated with the HLA-B27. You should remember that. And then you have the spine disorder, where the radiological imaging of a disc prolapse, spinal stenosis, and a spondylolisthesis will be there. You have to remember, you see the image and you identify what the problem is here. For example, the disc herniation, they may commonly ask you, and what level of disc herniation has been seen in this patient. You should remember the vertebral level, and you should be able to identify what level of vertebra the disc may got herniated. All those things are pretty important in the case of your orthopedic disorder. And then speaking about the musculoskeletal disorder, so you have the developmental dysplasia of your hip. For example, radiological imaging of hip joint, including the ultrasound and the x-rays they may give you, and they may check you like whether you can able to identify the dysplasia of your hip joint. Or maybe they may give you the congenital club foot is pretty important. They may give you the x-rays and ultrasound of this club foot, and they may ask you what it is. Or Leg-Perthes disease or Leg-Perthes disease, they may give you the x-ray of your like a hip joint, or they may give you the MRI of your hip joint, and they may ask you what diseases is associated with. And you have the Osgood-Schaltl disease, which is a radiological imaging of knee joint, including the x-rays and the MRI they may give you, and they may ask you what is wrong with this patient. So this kind of things are seen in the like radiology. So technically radiology occupies a 5 mark, people. So out of that 5 mark, the named signs, named views, named fractures, and basics of radiology, you may expect to see the 2 to 3 questions, and the condition specific or systemic radiology will you may expect to see the another 2 to 3 questions. If you're lucky enough, you may get the basics in 3 and the systems in 2. Or if you are very mastering in the if they want to test your knowledge with the systemic, then they go more on the systemic region over the basic region. So this is all about the one you may expect to see in the case of your radiology. So thank you everyone for watching the video. We will see you with a new subject.